So let's have a look at the exercise sequencing. In the intrinsic biomechanics model, all biomechanics coaches will follow this process. We always start by addressing the pelvis first. Rose McDonald's work looking at pelvic dysfunction found that 60% of injuries came from, or dysfunction came from, the pelvis. We know that the spine sits within the pelvis, so that would come next. And these two are inextricably linked, would be our start point to really prepare, give our clients capacity. Understanding then how we can move up into the shoulders, and this process of having patients early on really allows us to identify how many things solving the pelvis problem can really help. Maybe what we'll see is the shoulders improve when we improve function around the pelvis, or even the feet. If not, we take them through the rest of the program to really identify which body part is influencing which other body part. We could consider the pyramid model for each body part, so giving the pelvis capacity to then be stable, and then apply the performance model, and then the spine, and as we move through the body parts, doing the same thing. When we start making decisions, as Occam's razor suggests, we start with the simplest, least contraindicated intervention first. Low grade, 20% effort, muscle energy techniques within the pelvis can very often improve the function around the spine, maybe even knee stability. Certainly we've seen it up in the shoulder as well. Those 20% muscle energy techniques can be really quite powerful through the whole system. And we could do that in the spine once we've got as far as we wish within the pelvis. And then we can start to introduce lumbar joint mobility techniques. This helps to really mobilize the nerve roots around that area prior to prescribing, for example, slump techniques like the sciatic nerve mobility drill. Then we can come up into the thoracic spine for mobility work, and that again will mobilize nerve roots ready for coming into the shoulder with both muscle energy techniques and additional nerve mobility techniques. We know through the integrated system model of assessing everything that we can apply a muscle energy technique and improve the range of motion in nerves or even in joints, and vice versa. If the muscle energy technique doesn't work, we might then do a joint mobilization, and that may improve the muscle function. We may eventually get to the nerve mobilizations, and they do all of this. Throughout all of this, we want to really consider about conditioning or strengthening the rest of the body, using some of the science of reciprocal inhibition, so we start to move our client away from falling back into these problems. This is what a standard consultation or a screen might look like. We have those pre-questions to identify the client's reason for visit, and we set up their expectation about what's going to happen. Through the full screening program, we may take photographs or videos to show the client their improvements. Some of the screens may be behind them, and they may want to see what's happening. And we'll transfer all of this onto what we call our links man, and it's really basically an image of our skeleton that we can show them where the areas are that they don't move so well and how they may relate to the areas that could be symptomatic. We link all of this back to their reason for visit. This is about engaging the client, motivating them to really adhere to the program, so that when we teach them 2 or 3 exercises, we check with a hands-on approach that they understand that this 20% effort really is the game changer. Applying a rescreen immediately will confirm to us whether we're going down the right route, and also possibly to the client. Giving them that post-care advice about being symmetrical, or maybe using machines for a little while, is really important as well. We might also consider this model for preparing them, giving them stability, control, and then applying function and performance. Again, it shows the different modalities of machines we've talked about earlier, following through from symmetrical through to asymmetrical. So I'm not sure how your journey felt for you today. Hopefully there wasn't too much of stage 1 and 2, but if you do have any questions, obviously get in touch through biomechanics education.com. Through our learning program, we offer huge amounts of support through Biomechanics Education, but we also have our membership, which I'm going to talk about in a moment. But whether you join the IBA or not, all of our learners get support both during, before, during and after their training, get feedback on how they've done, and they might want some one-to-one time, particularly if they have any additional learning requirements. But we offer a lifelong learning promise about supporting all of our biomechanics coaches. So as I mentioned, we've got the Intrinsic Biomechanics Association, and this association has been really put together to offer huge amounts of resources and support. And once you're a member, you'll access all of these lists of benefits from webinars, we bring in guest lecturers, maybe you might even enjoy becoming a presenter, support from the master trainers and other coaches around the UK. And we have a free 12-week business accountability course for any of you out there who want that little bit of extra support. You get full access to a massive database in our IBA portfolio and ProZone with the FutureFit group of CPDs and online learning. Discounts within our group, that's Biomechanics Education and FutureFit. You get free branded clothing every year. And as a biomechanics coach, once you get your diploma, you'll be eligible to be found on our biomechanics coach map. And that will make you part of the register of biomechanics coaches who we really shout about with large organisations. As I mentioned, you've got that eligibility to present at the IBA webinars and maybe even to be considered to be a master trainer like myself, where you can go on and learn to teach this programme as we grow. We also have an arrangement where you get job opportunities in elite sport. A company called Aruse is looking for biomechanics coaches nationwide, predominantly in the south, but certainly are spreading out now. You'll get discounted insurance with BGI because they recognise our clients are safer with us as we use prevention tools and risk reduction tools. You get priority access and discounts from events, discounts with our partners on products, equipment, and some courses. So if you remember earlier, I spoke about the IME Free program of biomechanics coaching. And these are that referral network between each other and allow you to create a commercial offering that really speaks to every potential audience member out there. So I hope that was helpful. If you'd like to find out more, go to the website biomechanicseducation.com. You can get in touch with me directly at rachel@biomechanicseducation.com. Thank you for listening.